Ferdinand Waldo Demara Jr. never finished formal training in almost anything he became famous for doing. He had no medical degree, no completed theology studies, no naval commission earned through legitimate channels. And yet, across roughly 2 decades in the mid-20th century, he successfully posed as a monk, a psychology professor, a prison warden, a schoolteacher, a civil engineer, and, most astonishingly, a fully commissioned surgeon in the Royal Canadian Navy, performing real operations on real patients under a stolen identity with no formal surgical training at all. Demara's method was consistent across every impersonation. He would identify a real person with credentials he wanted to borrow, absorb their documentation and background details, and then present himself using that person's name and paperwork to institutions that rarely verified anything beyond the documents in front of them. He was extraordinarily well-read, with a near-photographic memory and a genuine gift for absorbing technical material quickly, which let him bluff convincingly in fields he had never formally studied. He first assumed a monastic identity as a young man, drifting between a Trappist monastery and later a Catholic religious order, teaching himself psychology and theology from library books along the way. His most famous impersonation began in 1951, when he took the identity of a real Canadian physician named Joseph Cyr, whose credentials he had acquired, and enlisted in the Royal Canadian Navy as a doctor. He was assigned to a destroyer during the Korean War, and it was there that his bluff was tested in the most extreme way possible. Wounded South Korean soldiers were brought aboard requiring surgery, and Demara, despite having no surgical training, performed the operations himself, reportedly studying textbooks between procedures and relying on his ability to project calm authority. Remarkably, none of the patients he treated died, and one operation, removing a bullet lodged near a man's heart, was reported in the press at the time as a heroic feat of naval medicine. The truth came out not because a patient was harmed, but because the real Dr. Joseph Cyr's mother saw a newspaper article celebrating her son's heroics and contacted authorities, since she knew exactly where her actual son was, and it wasn't on a Korean warship. The Canadian Navy, reportedly embarrassed but also aware that Demara had genuinely saved lives, quietly discharged him rather than pursuing serious prosecution, and he was allowed to leave without major criminal consequence for that particular impersonation. That should have been the end of it. It wasn't. Demara went on to impersonate a prison warden's assistant at a Texas facility, where he introduced genuine rehabilitative reforms that inmates and staff both credited with improving conditions, before his past caught up with him again. He later became a schoolteacher under yet another assumed name, and was reportedly a well-liked and effective one, until journalists who had tracked his story for years identified him to school officials. By the end of his life, Demara had become enough of a cultural curiosity that his story was turned into a 1961 film, The Great Impostor, starring Tony Curtis, and he spent his later years working under his own real name as a hospital chaplain and counselor in California, a role that, unlike nearly everything before it, he was arguably suited for by genuine experience, having spent a lifetime studying how institutions decide who to trust. He died in 1982. What makes Demara's story endure isn't just the audacity of the impersonations, but the uncomfortable fact that, again and again, the people he deceived came away better off than before he arrived, which raises the question his entire life seems built to ask. Does competence earned through study and nerve count for something, even without the paper to prove it?